A genetic mutation can significantly increase a woman's risk of developing breast or ovarian cancer. But does that mean everyone should be tested?
Only about 2% of the population really should be tested based on our current risk criteria. And only about 1 in 400 individuals in this country carry the gene mutation. While the test is a very simple thing to do, it's a simple blood test, the interpretation of the results can sometimes be very complicated. So working with a genetic counselor, working with somebody who understands genetics is very important, because a positive test has a plan that has to go with that. A negative test doesn't always mean that that person is no longer at risk, and there can even be an in-between result, a variant of uncertain significance. So getting the test results back without any other knowledge and without any other information is actually potentially a dangerous thing. Genetic counseling is an end-to-end process. It starts with obtaining a family history and understanding the risk or the likelihood of a gene mutation existing within that family. If testing is appropriate for that family and a person does then have the gene, the genetic counseling goes further and helps that individual understand what their risk is and what can be done to address that risk, either with increasing surveillance for cancer with the goal to try and detect cancer early, or through other means like medications that can reduce the risk of cancer, lifestyle changes that can reduce the risk of cancer, and then lastly, breast risk reduction surgery that can substantially reduce the risk of cancer as well. BRCA testing probably isn't appropriate for everybody. And I think the best advice I would give individuals is to talk to their doctor, to review their family history, to understand who is really the best candidates for having this type of testing done.